My name's Kayla Del Biondo. I'm coordinator of adult programming and outreach at New Canaan Library. And for those of you who don't know, tonight's program, which is called Concussions and Brain Injuries, How to Protect Yourself and Your Brain. This is actually a tie-in program to our month-long series, which is going on called One Author New Canaan, where we're celebrating the literary works for all ages from Jacqueline Woodson. This program ties into her book Before the Ever After, where main character ZJ is struggling because his father is experiencing concussions from his career as an NFL player. So if you haven't read the book, I encourage you to read it. It's called Before the Ever After. If you have, awesome. It's my pleasure tonight to welcome Dr. Nitin Sethi. Dr. Sethi is a board-certified neurologist and with interests in clinical neurology, epilepsy, and sleep medicine. After completing his medical school from the University of Delhi, he did his residency in international medicine in India. He completed his neurology residency from St. Vincent's Medical Center, New York, and fellowship in epilepsy and clinical neurophysiology from Weill Cornell Medical Center, also in New York. He currently serves as an associate professor of neurology at York-Presbyterian Hospital, Weill Cornell Medical Center, and chief medical officer of the New York State Athletic Commission. So we're very thrilled to have Dr. Sethi with us tonight. One other housekeeping thing before I turn it over to Dr. Sethi. Tonight we're using closed captionings, as you can see, probably coming up for accessibility reasons. If you don't need those, you're welcome to hover over the live transcript button of Zoom. Click on that and click hide subtitles if you want to hide it. And at the end of the presentation, I'm going to be doing like a Q&A panel with Dr. Sethi. So if you have any questions, please put those in the Q&A feature versus the chat, which can kind of get a little bit chaotic depending on how large of a crowd we have tonight. So thank you for being with us tonight, Dr. Sethi. I'll turn it over to you.
Thank you for the kind invitation. What I'll try to do today is I'll try to give you an overview of what is a concussion. How do you separate a concussion from a traumatic brain injury, or are they one and the same thing? And then I'll try to tell you a few practical tips on how you can identify a concussion. And lastly, how do you manage a concussion and how do you heal from a concussion? So I'll begin my presentation. I'll share my screen. So as I said, the main questions I'll try to answer: what is a concussion? Are concussions and traumatic brain injuries one and the same? How common are concussions? What are the signs and symptoms of a concussion? How do you diagnose a concussion? And what is the treatment of a concussion injury? Now, as in the introduction, I do work and serve as the Chief Medical Officer for the New York State Athletic Commission. For those of you who don't follow boxing, MMA, the New York State Athletic Commission regulates professional boxing and mixed martial arts in the state of New York. I also have had the honor to serve as a neurotrauma consultant to the NFL. The reason I say that is, one good way to look at concussions is if you follow these sports, if you're a fan of boxing, mixed martial arts, or football, or if you play any of these sports, you'll get a pretty good idea of what a concussion is. I'm going to show you a video from a boxing fight which happened in Madison Square Garden. And I think the video itself will help you to identify what is a concussion.
Menard's been a pro for 11 years and 2 months. Teofimo Lopez, 2 years and 1 month. Lopez, 9 years younger. Lopez lands the right hand. So much of the hype for so long tonight. And the build-up. And he comes out wailing away with a big right hand and a good combination.
Oh, this might be early nights.
Lopez. Oh, right. And down goes Menard. Oh, my God. knockout in the first round. A thunderous right hand and a backflip by Lopez, Brooklyn made.
So as you saw from that, that's the perfect concussion. And coming back to my first question, what is a concussion? So think about a concussion as a closed head injury. So when something hits your head, in this case, he's a professional boxer, he gets hit with a punch. Or for example, you walk into a door, or you bump your head against, you slip, you fall on ice, you bump your head against the concrete ground. The bulk of the force at that time is absorbed by the skull, and the skull is a pretty rigid bone. It takes most of the impact. It really protects the brain, but some amount of force gets transmitted across the brain. So the point I'm trying to make here is, you want to separate concussion from something like, like a gunshot wound to the head, where the bullet is physically going to the brain, damaging brain tissue. In concussion, nothing physically goes to the brain. It's just a transmission of forces. And like I said, a good way to look at concussions is if you follow or practice these sports like boxing, MMA, football, you can grade a concussion to a mild concussion, a moderate, and a severe concussion. Let me give you a few examples. A mild concussion. A boxer walks into a jab, or on the football field, you're sitting at an NFL game, you see helmet-to-helmet contact. For a few seconds, that player is stunned. If you ask these players, they might say, I felt my bell being rung, but there's no loss of consciousness. The ref will say, are you okay? Most of the time, the player will answer, yes, I feel fine, and the game goes on. So the definitions of concussions have changed. You don't need to have loss of consciousness for a concussion to occur. You could be walking out of a room, you don't see the door, you walk right into the door, you see the stars, your bell is rung, that might be a mild concussion. I'll give you an example of a moderate concussion. The example I showed you, a knockout in boxing, that's an example of a moderate concussion. You saw that the boxer was knocked out. As he fell, he had transient loss of consciousness, but you saw it was very brief. He immediately tries to get up. In fact, the referee is trying to hold him down. And then I enter the ring to take care of him. So a moderate concussion, there might be a brief loss of consciousness. And what happens is, when I initially go to the boxer and ask him questions like, do you know where you are? He may be a little confused. He may not know he's in Madison Square Garden. Do you know what date is it today? Do you know whom you're fighting? He's a little confused and disoriented. You give them some time, their mind starts clearing up, and he starts coming back to baseline. He'll tell you, Doc, I feel fine, let me get up. The fight is over. So a moderate concussion, there'll be a loss of consciousness. It might be very brief. And after that, that person who suffered the concussion head injury is slightly confused and disoriented. They might not know where they are. They might not know what exactly happened. A little confused. You give them some time, they start coming back to baseline. I'll give you an example of a severe concussion, like a patient I saw in the concussion center. Like most of us, lunchtime, that lady was crossing the avenue and she got hit by one of these e-bikes. Now she flies off, she falls down, her head hits the cement, and she has a complete loss of consciousness. Her next memory, if you speak to her, is waking up in the hospital surrounded by doctors. She has no recollection of the bike hitting her. She doesn't know who called 911, the ride to the hospital. So a severe concussion, a more prolonged loss of consciousness, a more prolonged period of post-traumatic amnesia. They're more confused and disoriented for a longer period of time. So a concussion is basically a clinical syndrome. It depends, obviously, there has to be a history of head injury or a sudden force. The reason I say that is you don't need to have something hit your head directly for you to have a concussion. Like in this case, the boxer, You can have a whiplash injury. You're in a car, you get T-bone from the side, and you have a little bit of a whiplash injury. It's a transmission of forces, and you might get a concussion. And then the second thing which happens is when you suffer a concussion, you have typical symptoms. Like I said, there's a little brief loss of consciousness, the fear of confusion and disorientation. And then there's certain findings on physical examination. So as I pointed out, you can grade a concussion. Even as a layman, you can grade a concussion to a mild concussion, a moderate, and a severe concussion. And as the picture also says, concussion is very common, and it doesn't always occur in combat sports like boxing, MMA, or contact sports like football. And pretty much all sports you can get a concussion. It's common in soccer, common in lacrosse, and people who don't play sports get concussed when they have some sort of an accident. So one problem with concussion is the term is used in a very sort of non-scientific way. And that's why I've titled it Concussion is Confusing Us All. There's no real clear definition of concussion. If I ask somebody, what do you mean by a concussion? You'll get all sorts of answers. Historically, though, if you look at the medical literature, the term was used to describe patients who are briefly disabled following a head injury with the assumption that this was a transient disorder of the brain without long-term sequelae. That's important. It was thought to be a transient head injury. You get, for a short period of time, you're transiently off, you have a neurological dysfunction, but there's no long-term sequelae of concussion. You recover and you come back to baseline. Symptoms are highly variable in duration, and they may persist for many years with no reliable early predictors of outcome. So one problem with concussion we have is we don't have a validated test for concussion. So let's assume you come to me and you say, hey, Dr. Sethi, I'm worried I might have, let's say hepatitis B. I can do a blood test. If it's positive, I can say, I'm sorry, yes, you do have hepatitis B. If it's negative, I can say, I reassure you 200%, you don't have hepatitis B. That's the problem with concussion. We don't have a diagnostic test for concussion. There's no test I can do on your blood or even on your spinal fluid, any MRI, which can tell me, are you concussed or you're not concussed? It's predominantly a clinical syndrome. So the patient will say, I got hit, and after that, I'm having now headache, I'm a little dizzy, bright lights bother me, loud sounds bother me, I feel a little nauseated. A bunch of concussion patients report symptoms which are related to like the higher mental functions. I'm more confused. I'm more disoriented after the head injury. I feel my memory is off. My short-term memory is off. Some people will also report symptoms like I feel I'm more anxious after head injury. I'm more irritable. My sleep is off. So there are a bunch of these symptoms. They are highly variable. In some patients, they are very transient and they recover pretty quickly. In some patients, these symptoms will persist for many, many years. And as a result, because of what I've told you, there's a lot of misconceptions and biases in the public domain about a concussion. And that's why I feel one point I'd like to hopefully convey to you is, when do you use the word concussion, and what's a better scientific way of identifying your head injury? So how do you say one has had a concussion, which is more from like a mild sort of injury, versus somebody who has had a traumatic brain injury? It's very difficult to separate a concussion from a mild TBI, because injuries which lead to a concussion and injuries which lead to a traumatic brain injury are biomechanically similar. The boxer I showed suffered a concussion. He fell down, his bell was rung, he immediately tries to get up. He was confused and disoriented for a few minutes, and then he came back to baseline. But we also have noticed that players can get hit. They can suffer a more severe traumatic brain injury. So I think the better way is one should attempt to classify the severity of the brain injury and then to precisely diagnose the underlying cause of the post-traumatic symptoms. So what I'm trying to say is, instead of using the word concussion, which is not really very scientific, you try to figure out exactly how severe is the traumatic brain injury. Is it a mild traumatic brain injury? Has my patient suffered a moderate traumatic brain injury? Has he or she suffered a severe traumatic brain injury? And then I try to diagnose the underlying cause. What is the cause of the post-traumatic symptoms that my patient is having, like headache, nausea, light sensitivity, sound sensitivity, problems with memory? So this is slightly a more scientific slide, but I'll try to make it simple. If you look at the left end of the slide, you'll see the fact that I've written concussion, and I've said there's no structural damage in concussions. What does that mean? So let's assume somebody suffers a concussion, and you go to the ER or urgent care, and you're worried, I may have a bleed in my brain. The ER physician at times might just simply examine you. He or she will do a neurological examination, and they feel that you are basically okay. They might just reassure you and say, listen, it's likely a concussion. You don't need even a CAT scan. Go home and rest. Sometimes they'll do a CAT scan of the brain. Usually a CT scan is done. Sometimes even an MRI can be done. But the MRI or the CAT scan will show no evidence of any structural brain damage. So when the report comes back, it'll be a normal CAT scan and a normal MRI. That's the important thing in concussion. The scans will come back negative. Now, the patient may have post-concussive symptoms like headache, dizziness, sleep disturbance, cognitive impairments, anxiety, depression, but the scan is negative. On the other hand, when you're talking about traumatic brain injury and you're dividing them into mild, moderate, and severe, what you're really meaning as a neurologist is, as you go from a mild traumatic brain injury to a severe traumatic brain injury, my patient will show more structural damage on the CAT scan or MRI. So there'll be evidence of damage in the brain, blood in the brain. That is basically the thing which means increase in structural damage. But if you look at the symptoms the patient will say are exactly the same as the symptoms of a concussion: headache, dizziness, sleep disturbance, cognitive impairments. So again, emphasizing it's very hard to separate concussion from mild, moderate, and severe traumatic brain injury. So the better way of trying to classify head injuries is what's shown on the right. And this is from the Mayo Clinic. How the Mayo Clinic does it, they really take out the word concussion completely, and they try to classify head injury as possible head injury, probable or mild, and definite or severe head injury. And that's based on increasing amount of structural damage which you see on the CAT scan or the MRI of the brain. So again, emphasizing, many people use the word concussion. It's a good word, but it's not very scientific. It's better to try to grade your patient's head injury as possible, probable, definite, mild to severe, rather than just throwing the word concussion, which doesn't have much of a scientific meaning to it. So biomechanics of concussion. So as you can imagine, the concussive properties of a blow, any sort of blow which hits the head, whether it's a punch thrown at the head, whether it's you walking into a door, somebody falling down, slipping on the kitchen floor, hitting his or her head against the floor. The concussive properties are related to the manner in which the blow is delivered. Which way is the blow delivered? So example, you can have a punch thrown at you like that, and you can have a punch which comes from the side. So it's the manner which the blow hits you, and how the mechanical forces are then transferred and absorbed through the intracranial cavity. So the essential feature of a concussive force is the force is to be sufficient enough to accelerate the skull. So you have to have some sort of a force which is sufficient enough to make the skull move. And you can have rotational angulation, and you can have linear acceleration. So you can have a force which comes linearly, like somebody, for example, if you get, let's assume you walk right into a door, that's more of a linear force which hits the head right up there, as compared to like a punch thrown from the side, which makes your head swing to one side. Now, most of the forces which are delivered to the head are usually a combination of the linear and the rotational acceleration. So any type of force which hits the head, even when you fall, You may fall right flat like that on the ground. You may fall at an angle. So it's usually a combination of these type of different forces. And I'm sorry, the slide does not project well, but you may ask me what happens in a concussion. So contrary to the initial thinking that concussion causes no damage to the brain, actually, if you look at the brain on a microscopic level, so if actually somebody was looking at the brain under a microscope, you find that during a concussion, a lot of changes happen in the brain. There is some cell death. There's an altered neurotransmission, so signals are not flowing from one nerve cell to another nerve cell properly. There's an energy crisis in the brain, and there's some injury to the brain. So our earlier thoughts that concussions are very benign, oh, don't worry, it's a concussion, shake it off, continue to go do your work, continue to play. That thinking has evolved now to a better understanding of concussions. And again, because of those cellular changes, you have a lot of the post-concussion symptoms. So people who have suffered a concussion will complain of headaches. They'll complain of the fact that, hey, Dr. Sethi, after the head injury, bright lights bother me, loud sounds bother me. I feel my memory is slow, cognition is impaired. I can't multitask. When I'm on my computer, I find I'm very slow. So all that slowed processing time, slowed reaction time, that all has been linked to changes which occur in a neuron at the microscopic level. Now, I want to emphasize one thing which always has helped me well as a doctor, and also because I deal with a lot of concussions. I head the concussion center here at Cornell. Is I always say the face is the mirror of the brain. So if you look at this slide, the reason I put this slide up, if you look at the left-hand side of the slide, that's the MMA fighter before the fight starts. You can look at his face. It looks like you and me. And you look at him towards the end of the fight. You see a lot of blood on the face. You feel a lot of swelling on the frontal part of the face. The eyes are swollen. What does that tell me? That tells me I need to look at this fighter more closely. He might have suffered some sort of head injury. So if you fall down and you find you're bleeding a lot, face is all swollen up, it's a lot of bit swelling, yeah, I think that's reason enough to say I like to go to the hospital and get myself checked out, because the face is the mirror of the brain. You have evidence of facial injury. You should worry about the fact that maybe I might have also a head injury. So again, emphasizing the fact concussions, I just showed you a video of concussion just because I think that's a boxing video is a good way to look at a perfect concussion. But concussions are not unique to combat sports. They can occur, in fact, in anything which we do. But if regarding sports, you can see them when you're playing soccer, lacrosse, ice hockey, even while you're swimming. So it's a very common head injury. It can occur in different forms, like I said, mild, moderate, and severe. And a few more slides. So now, how do you go about managing a concussion or a traumatic brain injury? So if you look at this pyramid, the lowest part of the pyramid is educational measures. That's, I think, is the most important thing. Educate, educate, educate. And that's what I'm trying to do here. I'm trying to educate. Remember, concussions, mild concussions can be missed. They are very, very mild. For example, you walk into a door, you feel your bell is rung. It might be missed. That used to happen in football all the time. Oh, that's fine. A little bit helmet to helmet contact. Let the player continue to play. No, you have to be very careful. You need to be educated about a concussion, how concussions present, and what are the symptoms of a concussion. So somebody is playing soccer, he or she heads the ball, they feel that their bell is rung. You got to ask them, pull them out. I say, how do you feel? Do you know where you are? What's today's date? So I'm trying to figure out how well he or she is oriented. Okay, then I'll do you know where you are? Do you know whom you're playing? Then the next thing I'll do is I'll try to do a little bit of a neurological examination. So I'll check their eye movements. I'll check their balance. Okay, that's very important part. If they're clearly off balance, they're staggering, I'll kind of tell that I know that they have had a concussion. And then, is a more sort of a, if I feel they're concussed, I will bench them. I'll say, no, you cannot go back into the game. You need to sit it out. So education. How does a concussion present? What is a concussion? How do you identify a concussion? And then how do you manage it? So first is education. Then obviously, a lot of concussion patients will land up in the emergency department. So when you come to the emergency department, what happens? Usually the ER physician will do a more detailed neurological examination. He or she will again ask you a lot of questions to assess how oriented you are. Are you confused and disoriented? Okay. They might do an imaging study like a CT scan of the head or an MRI of the brain. And based on that, they'll decide, do you need to be admitted? Can you be discharged? With advice to follow up with a doctor or a neurologist. Now, in people who obviously suffer more severe head injuries, moderate or severe head injuries, they obviously need more specialist review. They are the ones who are seen by a neurologist like me in a concussion center, or heavens forbid, there's a bleed in the brain, a neurosurgeon has to be involved. And then obviously those patients are then admitted to the hospital, and depending upon the severity of the traumatic brain injury, we manage them accordingly. So how do you manage somebody who has suffered a concussion? So let's assume you are walking back home today. After I finish up this talk, I'm going to take the Q train, try to get back home. And heavens forbid, I fall down and hit my head against the ground. What will happen? Usually, if I'm seen by a doctor, the doctor will say, you got to take a few days of cognitive and physical rest till the acute symptoms abate. What does that mean? That for a few days, think of it, you are bench. You have to take a few days of both cognitive rest, that means giving rest to your brain, and physical rest, that means giving rest to your body, till the acute symptoms of the concussion abate. That means the acute symptoms like severe headache, a lot of dizziness, you're nauseated, the patient is throwing up, they need to abate. For that period of time, you need to give them cognitive and physical rest. Now, you might say, why did that recommendation come out? The reason that recommendation came out was that a concussed brain does better when the cognitive and physical demands on it are less. So for example, I suffered a concussion and I go home and I just rest. I hydrate myself, I relax, I'll do better. Now, suppose I suffer a concussion today, but I don't go home and rest. I go back to work, I start multitasking, looking at patient studies. What will happen is I'll become more symptomatic. I'll start having more headache, more nausea, more dizziness. So a concussed brain needs rest. You need to give the brain some time to recover. Think of it as if you are again, like in a boxing match, you got hit. You now want to give the brain some time to recover. So that recovery period might be 2 or 3 days, 4 days, 5 days, till the acute symptoms abate. So once the acute symptoms start going down, what you do is you instruct your patient, listen, now you can begin a graded return to work and a graded return to exercise, meaning that you don't go from being sitting at home to suddenly coming back to your office and start seeing 20, 25 patients running around here and there. No, you got to come back and slowly start increasing your workload. Same thing applies to exercise. You don't go from being concussed to suddenly start going going out, running 2 or 3 miles. No, you want to go slowly. So that's the most fundamental part which you need to understand. And this holds true for all types of traumatic brain injuries. Rest, rest, rest initially. Cognitive rest and physical rest. Let the brain heal and then instruct your patient to begin coming back with a graded and gradual return to work and a graded and gradual return to exercise. Let's assume as he or she is working or exercising, they become again symptomatic. What does that mean? Well, you cannot go forward, stay at that level, let your brain recover, it needs more time, and then let it come back to baseline. By the way, a lot of the concussion literature does not come from the NFL or boxing literature, it comes from the battlefields of Iraq and Afghanistan. When the soldiers go out and those IEDs go out, they used to get concussive injuries. And concussions and mild TBI are the signature injuries of the wars of Iraq and Afghanistan. So that's where a lot of this data is coming out. So you give them cognitive and physical rest, and again, a graded and gradual return to work and exercise. I'll give you another example, like what happens in the NFL. So When I'm on the sidelines of an NFL game, let's assume the athlete suffers a concussion. You'll see that he's pulled out, the tent goes up on the sideline, the athlete enters the tent, I'll go inside, I'll do a neurological examination, I'll ask him the questions to figure out if he's oriented or confused or disoriented. I'll check his balance. And then if he's concussed, he's benched. That means he's not allowed to go back or return to the game. Now, then he enters a concussion protocol. So a few days of rest, and then he begins a return to play protocol. So what's the return to play protocol? So let's assume the athlete comes back. The trainer puts him on a stationary bike, like a spinning bike. He starts spinning. Heart rate goes up. So he's exercising. How do you feel? Oh, I still feel I feel headachy. I'm dizzy. I'm not feeling well. Okay, fine, stop. You cannot go forward. Rest a few more days, and then we'll go forward. Let's assume as he exercises, he's asymptomatic on exertion. Okay, now you can progress to more strenuous exercise like a treadmill. He clears that. Okay, tomorrow you can start doing the drills, then practice, then full practice. And if he's asymptomatic, he's clear to return to play. That simple thing actually holds true for all types of head injuries, whether they occur while you're playing a game, or whether they occur, like, for example, if one of us is walking outside and gets hit by a bike or falls down. So I'll stop here. I'd rather keep a lot of questions. If you have any questions, I'll be happy to answer them more in more detail.
Thank you, Dr. Sethi. Let's see if people have questions yet. At this point, like we said, you can go ahead and put your questions in the Q&A feature. I see one so far for you. So someone asked, is there any research that indicates a relationship between concussions and Parkinson's disease?
That's an excellent question. And as you know, one thing which is coming out is that multiple concussions are not good for the brain. Nobody can say a head injury is good for the brain. So when you take people like professional boxers who are getting multiple concussions all the time, then at a later age, like when they're in the late 30s, early 40s, you find that some of these boxers will have Parkinsonian-like features, like they're walking with a shuffling gait, their speech is slightly slurred. So there is something called post-traumatic Parkinsonism. It's not Parkinson's disease, it's Parkinsonism. So it looks like Parkinson's disease, but it's not Parkinson's disease. But yes, in reply to your question, there is post-traumatic Parkinsonism.
Thank you. A follow-up question to that. Someone wants you to speak to just more general dementia and concussions.
So as a lot of you might be aware of, there's a term called CTE, chronic traumatic encephalopathy. That was the term which was made popular in the movie Concussion with Will Smith. So what is CTE? What was happening was in these NFL players, when they were retiring, late 30s, early 40s, they were complaining of memory problems with attention, concentration, mood and behavioral changes, anxiety, depression, aggressiveness. So when their brains were looked at, I mean, when they had unfortunately passed away and their brains were studied, they were cut up and studied under the microscope, you found that there was this deposition of this protein in the brain. And that is what is called as CTE, chronic traumatic encephalopathy. Again, emphasizing multiple concussions are not good for the brain. By the way, the term CTE or the disease CTE is not specific for like NFL. You know, if you look at, or football, sorry, if you look at the boxing literature, you'll see terms like dementia pugilistica or punch drunk syndrome. A boxer is punch drunk, you know, they walk as if they're punch drunk. So, you know, the same problem was identified in boxers, again, emphasizing multiple punches to the head are not good. So just like anybody else, we need to be protecting our brain. It's our most vital organ, you know, and head injuries, multiple head injuries have been linked to cognitive problems, post-traumatic cognitive deficits, memory problems. So yes, I'm very much passionate about, how do you protect the brain, especially how do you protect the brain in professional athletes whose job, unfortunately, that's their profession. They are exposed to minor head injuries or concussions all the time.
Thank you. Kind of going off what you said about anxiety symptoms, someone said, I got a panic attack after getting a concussion. Is there a link between concussion and anxiety attacks?
Absolutely, there is. And that's why when I told you about the post-concussion symptoms, I said the common post-concussion symptoms, headache.
Right.
It's called post-concussive headache, a subjective feeling of being dizzy. The patient feels dizzy or off balance. The patient will say, bright lights bother me, loud sounds bother me, I'm nauseated. Then the patient will report symptoms related to cognition. My short-term memory is off, my attention is off, my concentration is off, I feel foggy, fuzzy in the brain. But there are a substantial number of patients who report symptoms, I'm more anxious after concussion, I'm more irritable after concussion, I'm more depressed after concussion, I'm more moody after concussion. So we don't know whether it's the concussion which makes an underlying anxiety disorder worse. So somebody has anxiety disorder and they get a concussion on top of that. Does the concussion make the anxiety disorder worse? We don't know that. But there's also another school of thought which says that people who have underlying anxiety disorder, when they get concussed, their symptoms tend to persist for a longer period of time. So I would say yes to your question. There is a link between concussion and anxiety. And there are a lot of people who suffer concussion, and the main symptom after a concussion might be, or one of the main symptoms might be that they're more anxious, they're more depressed, they're more moody.
So someone brought up a good question about age. This person's wondering, do you do anything different for children with head injuries versus adults?
That's a very good question. By and large, pediatric concussions, the way to look at it is that the thinking is a child's brain, a pediatric brain, is more sensitive to concussion than an adult's brain. So, and if you ever look at a small children, they are bobbleheads. They have a narrow neck. The head is broader, so they're more prone to falling and toppling over. That's why nowadays there's a lot of emphasis on trying to prevent concussions in children right from the school age when they start playing sports, having athletic trainers or coaches who know how to identify a concussion, especially a subtle concussion. Even parents who work on the sidelines should be taught how to identify a concussion, because yes, the pediatric brain is more sensitive to a head injury. And a lot of times children cannot express that they've had a concussion. It's hard for a child to say, I have headache, I'm dizzy, the lights are bothering me. The child might just manifest by being just more irritable, more cranky, and it's really, you might not even know the child has suffered a concussion. So I personally feel that we need to spend a lot of time in education. We need to prevent concussions in the pediatric age group. The management is essentially the same. You give them initially some rest, and then you slowly try to get them back to baseline.
Got it. So in addition to people resting after a concussion, someone wants to know, is there any like special diet recommendations that they could follow, any nutrition, vitamins to take for optimal brain health following this type of injury?
Yes, they are. So one thing which I always tell is a concussed brain likes water. So hydrate the brain a lot. Hydration is good for a concussed brain. Mm-hmm. A concussed brain does not like alcohol. So during the time when the patient is acutely symptomatic, I'll advise my patient not to drink. The reason being, it's not that the alcohol is going to damage the brain. It's just going to delay the healing process from a concussion. So I would say during the time when you are acutely symptomatic, avoid alcohol. A concussed brain does not like to be inverted. So if you are the yogas and Pilates person and you just had a concussion, you don't want to be doing a headstand or things like that. Avoid sudden bending down. Sleep is very good for the brain. Sleep is thought to be restorative. It restores the brain. It brings up increases your immunity. So good sleep hygiene. Make sure that you entrain your circadian rhythm. That's your sleep-wake cycle. So when you sleep, your sleep is consolidated and deep sleep. It's very restful sleep. That's very important. As regarding supplements, usually what I recommend, magnesium oxide is thought to be very good for a concussed brain. It's also very good supplement anyway for the brain. Magnesium is again neuroprotective. So I'll usually put the patients on magnesium oxide. It's over the counter. I'll start at 100 milligrams and probably for an adult go up to about 300 to 400 milligrams a day. I'll combine that with another vitamin called vitamin B2 or riboflavin. Again, start at 100 milligrams, go up to 300 to 400 milligrams a day. Both magnesium oxide and riboflavin are exceedingly safe. There are no side effects of these vitamins. I'll throw in vitamin B12. B12 again is a vitamin which is thought to be good for the brain, good for memory. Again, it's a water-soluble vitamin, so it's very safe to take. I'll throw in some fish oil. And so, and as well in the diet, there is a brain healthy diet. It doesn't really apply to just to concussion, but a typical brain healthy diet is basically a modification of the Mediterranean diet. So plenty of vegetables, food should be made in extra virgin olive oil, less of red meat, more of fish, a lot of nuts, avoid dairy, not too much of dairy. If you like an alcohol, usually red wine is thought to be good for the brain and the heart. And that really is like a Mediterranean diet, which is also good for the brain in general.
Thank you. I'm super interested personally in brain food, so that I liked that question. Someone asked, if you've had a concussion, are you more susceptible to another concussion with less force in the future?
That's an excellent question. And I have seen patients who, when they get a concussion, and it might be a mild concussion, like I saw somebody and they got a concussion when they were at work, got up suddenly and bumped their head against the desk. Any of us can get it. Seemingly a mild concussion. But every time that patient gets a minor bump to the head, that he reports that post-concussive symptoms again. The headache comes back, the dizziness comes back. So we all get minor bumps to the head. We'll all get bumps to the head. Somebody's elbow hits your head. You walk into something. Usually the brain is very protected, but there are certain people who are very sensitive to concussions. And for them, even minor bumps to the head, they will have post-concussive symptoms. My feeling with professional athletes is, and you'll see that in boxers, they'll say he has a glass chin. Every time he gets even touched on the chin, he gets knocked out. Now you might say, how did they develop a glass chin? Over the years, they've been knocked out multiple times, and now they're just more susceptible to a concussion. So yes, I feel multiple head injuries probably make you more susceptible to the symptoms of a concussion.
So it looks like we have two more questions. Let's see. The first is, how long does cognitive impairment typically last after a head trauma?
Cognitive impairment can vary. I have patients who, by and large, concussion is a self-limited illness. So if you look at the concussion literature, majority of people should recover from a concussion in about 2 to 4 weeks' time. Okay, so if you look at a Bell's curve, all of us who suffer a concussion should probably recover in 2 to 4 weeks' time. But there are patients who will recover earlier, and there are patients for whom the post-concussion symptoms will persist for a longer period of time. We don't know why some patients are more susceptible to a concussion, why post-concussion symptoms persist for a longer period of time in some people, and some people recover from a concussion quickly. I mean, I give this example all the time. Let's assume we both walk into the same door. You may have one person who says, yeah, I felt my bell being rung, but I'm fine. And the other person is, oh, I have a severe headache. I'm very dizzy. I'm very nauseated. My attention is off. My concentration is off. Same force. Why such different presentations? Well, because I think we are susceptible to concussions, and each of us have a different susceptibility.
Makes sense. So the last one, this person just wants to know, if you have one concussion and then you have a second concussion shortly after, are there certain risks, like in terms of symptoms and recovery, for having two concussions pretty much back to back?
The way I'll answer that is, I'm very passionate about brain health and how to protect the brain. You have suffered a head injury. It might be a mild head injury, but it was a head injury. And you want the brain to recover. You want to nurture and nourish the brain, give it a good diet, a lot of rest, keep stress levels low. Stress does not help recovery from a concussion. Take the supplements and try to let the brain recover. Now you suffer a second concussion. Obviously, that has not helped my patient. Okay, sometimes concussions occur. It's not in our hands. We might just have bad luck. But if you can avoid a concussion, obviously that's the best thing. So what does that tell me? Wear the right protective gear. I have patients who are cycling. Summer is coming, spring is coming, summer is coming. You'll have people. I ride the city bike. I know how quickly you can fall off the city bike. You hit a pothole and you go right off over the bike handles. Sometimes you're crossing the avenue and a bike nearly hits you, both ways. And I've seen people getting concussed falling off a bike and people getting concussed after being hit by a bike. But at least for the bikers, they should wear a good helmet. So wear the right protective gear, invest in a good helmet. If you're doing sort of an activity which has a concussion risk, wear the protect yourself, do all the necessary things which you have. Snowboarding, you're wearing a helmet. And that's very important because if you can prevent a concussion, you protect your brain.
So the good news is prevention.
Prevention.
That's what it sounds like you're saying. So we don't have any more questions. I'm just gonna, I don't know, you seemed really passionate in that last question. I'm just personally curious, what kind of sparked, as you were going through, your studies in med school and whatnot, your different residencies, what kind of sparked your interest in wanting to specialize in what you specialized in?
Well, I was born in Buffalo, New York. My parents had come over to America to do their residencies. My father's a neurologist, and my mom is done pediatrics. And dad and mom decided to go back to India. So I was born in America. I was a U.S. citizen, but I was raised in India all over throughout my years. I did my schooling there, my medical school there, and I was about to enter neurology. And my dad said, Nitin, you got to go to America. You got to go and train. He trained in Buffalo, and he said, you got to go and get trained in neurology in America. So I came here. I did my residency from St. Vincent's. Excellent hospital. I was so sad when St. Vincent's doors closed. And then I got my fellowship at Cornell, and now I'm working at Cornell. And, when I first landed in New York in 2003, so that was the first time I came to America. I was a US citizen living in India for so many years and never seen this country yet. So I was really lonely. I was doing my residency. I knew nobody in the city. So I walked into a boxing gym. And the trainer saw me looking inside. He said, do you want to box? I said, yeah, I want to box. And I started boxing. And that's how my love interest with boxing started. And then I was very fascinated by traumatic brain injuries and concussion. So at some point in time, I wanted to mix my two passions, my love for boxing and my love for TBI, traumatic brain injuries. So I applied to the Boxing Commission. I said, I want to work for you as a ringside doctor. So I started working as a ringside physician. And then a few years ago, I was made the chief medical officer, big honor for me. And so, yeah, I think I'm just very passionate about head injuries, everything about the brain fascinates me. But concussion is an injury where it can be prevented. And there are many things we all can do to make our brains healthy, especially during the pandemic. I see a lot of patients. This pandemic has been hard for all of us. And a lot of anxiety disorder, depression, problems have come up. Hopefully the world opens up, and the brain really needs. I think one thing which a lot of literature which is coming out is people who are cognitively active. You're using your brain a lot. You like to talk. You have good circle of friends, social circle. You're passionate about something. You like to play an instrument. You have a hobby. They are the ones who have, you try to prevent anxiety and depression. They're the ones who have a longer, healthier life. Nowadays, there's a good amount of scientific literature to say that anxiety and depression leads to memory disorders, cognitive problems later in life. So I think for the brain health, what is very important is physical exercise, but then also you want to keep your brain healthy. And my father tells me like this, he says, you cannot have a healthy brain without a healthy mind. Okay, so you have to have a healthy mind. Anxiety, depression, try to treat it. Good thoughts. You have to have a healthy mind to have a healthy brain. And sometimes we get hit with brain diseases, but there are certain things we can all do which can keep the brain and the mind healthy.
Amazing ending. I love hearing how you had that interest in boxing and how you were able to marry your two passions, like you said. So thank you so much for your time and sharing your expertise. People are already singing your praises in the chat, saying marvelous program, excellent speaker. So I really appreciate your presentation with us tonight and going through all of those audience questions. Thank you.
Thank you so much for having me, and thank you for giving me this honor.
Of course. Thanks, Dr. Sethi. Really appreciate it. Take care, everyone. Good night.